Well, I didn't know I had cancer. So I went and seen my doctor as a visit. And she asked me, could she do a x-ray, I think, from the top lung to the bottom.
My name is Kate Tackett. I'm a family medicine physician, and I work at the Prestonsburg Family Care Clinic. Kathy is a patient of mine. I started seeing her probably more than a year ago. She came in for just a regular medicine visit one day and had been a smoker for a really long time. Lung exam was totally normal, but as part of the screening routine, we ordered a low-dose CT on her, and we ended up finding a very early small cell lung cancer.
Next day, I think, she called me and told me to come in. And when I went in, she told me I had cancer.
The big thing with low-dose CT is that you're not symptomatic of lung cancer at all. So she had no shortness of breath, no wheezing, no coughing up of blood or anything like that. And so as she was totally asymptomatic, we wanted a good look at what her lungs looked like and to make sure she didn't have an early cancer, and low-dose CT is the best way to do that.
No symptoms of it that I had it, no. I was normal, no symptoms of cancer.
So after we got Miss Poston's low-dose CT results, I brought her in and we had a conversation about what was the next step, who she would need to see, and what the potential next diagnostic evaluation would be. And she took that really well. She is a woman of faith and said that she put it to God and she trusted God to do what was best for her. And we said a little word of prayer and we got her set up with all of her follow-up appointments. And they set her up with our hematologist, oncologist from there.
My name is Vinay Vermani, and I do oncology and hematology at King's Daughter. I started my practice here in April 1988. I saw Kathy about in April of this year because of her history of smoking for many years. So I think she's our family doctor. And then she had a low-dose CT scan, which we do for screening for lung cancer. So this low-dose CT scan is done on the patients, and they have 30 or more than 30 pack-year history of smoking. So the idea is we can catch the lung cancer in an early stage. They found a lesion in the left upper lobe. So when they found a small lesion in the left upper lobe, she had a biopsy done. After the biopsy, she was referred to a thoracic surgeon. And then she was very lucky that her cancer was still confined to left upper lobe, single lesion. They checked her lymph nodes. Her lymph nodes were negative for the cancer. So this early stage lung cancer, particularly in her type, which is small cell lung cancer, we only find in less than 5% of the cases. So after the surgery, she was referred to me. So I saw her, and then we started on chemotherapy. She's done with the chemotherapy. We'll be monitoring her closely, so she will come for periodic CT scans and follow-ups and all that.
Yeah, they called it early on me. I think Dr. K said it's like 2 months or something early cancer. But if they hadn't caught it in time, I probably wouldn't be here. So I'm glad, I went that day to her and she found it.
A good primary care physician should know all of the screening guidelines, and at the very least should know where to find them if you're a little unsure on maybe the age guideline or pack year history or whatever it is. But we're really the gatekeepers. We see patients first and we usually see them earliest. I think as a family medicine physician, if you're not passionate about that screening and trying to find cancers really early, then your patients don't really know the importance and won't really think it's important themselves. So I think it's our job to portray how important that is to the patients and to let them know that this is something important and it is something that can save your life.